want to go over some spine anatomy in a minute and give you some perspectives, some basics on what you expect when you come to the office and we go over things. This is a model of the cervical spine, the neck coming in from the side. This is the back of the skull, and the orange material here represents the spinal tissue. Okay, this is the cerebellum, the back of the brain, pons, the medulla, the spinal cord being that orange stripe going down the center of the canal right here. Now, these little nubs that you see my finger running on, that's the spinous process. Those little nubs in the back of your neck when you run your hand up and down your neck, that's what you see there. These shingle-like structures that come off the back, those are called lamina, and they will connect off on the sides. It's called facet joints. They're little offset little connectors, and that's where motion takes place when the head moves forward and back, sideways, and rotates. The body of the vertebrae are these block-shaped structures that you see here, 1 to 7, C1, C7 down here at the base of the spine. That's typically one of the biggest little knobs that you feel in the back of your neck when you put your hand at the base of your spine. That's usually C7 or the first thoracic vertebrae there. Now, these silicone spacers represent the disc that reside between the vertebrae. These are the spacers that are present. They help keep the nerve holes or foramen open where the nerve roots exit. And what you're seeing here, these little orange tabs coming off, those are the nerve roots that are represented here. The red in this model represents the carotid arteries on either side that come up into the brain, and they are off just to the side of those vertebrae there. Typically, when we go through the examination and the x-rays and the MRIs or other studies, we're looking for problems with one or several of these discs that are pushing back on the nerve sac and or the nerve roots. And those can most likely be our pain generators. And typically we'll try physical therapy, medicines, traction, sometimes cervical epidural steroid injections, or ESIs for short, trigger point injections, many modalities we can use to address disc problems in the neck. And if they're effective and the pain's manageable and it goes away, great. So our hope and wish and prayer for you is, if despite all that, the problems persist and you're not getting well, and let's say we've isolated it to one disc, one level, well, how is that addressed? Sometimes we'll advocate a surgical procedure, an anterior cervical discectomy infusion, ACDIF for short. Anterior meaning going through the front of the neck, usually typically in a skin fold here, moving the trachea, the air pipe, and the esophagus, the food pipe to the middle. Carotid artery, move that to the other direction. Come down and examine the vertebrae and come down to where the disc is and take that disc out. I think before I said carotid artery here, that is the vertebral artery. Carotid artery is the big external artery here. Vertebral arteries are the red arteries that we see here in the model.